We need to give the hepatitis B vaccine to travelers, but also to patients who are at risk and remain here in the country. And of course, the Green Book does indicate to us exactly what groups of patients should receive the vaccine on the NHS. The question is more difficult when it comes to employment, where the patient, as an employee, may, in the context of their work, come in contact with the hepatitis B virus. Well, in that situation, the Department of Health puts the responsibility for the vaccination on the shoulders of the employers. Now, the question comes, of course, do I use a national health vaccine, or do I use a hepatitis B vaccine that I purchase privately and do the immunization privately? When it comes to the groups at risk in the Green Book, the hepatitis B vaccine we use must be the NHS vaccine. Now, if you are a GP in England and Wales that you are not a dispensing practice, you could, in addition, claim reimbursement for the vaccine. That's fine. Or you can put it on an FP10, that is the prescription. But when it comes to our group specifically, the employees, where the employer is responsible, then we don't use an NHS vaccine, we send them back to their employer. Now, the employer may contract the GP to do it, that's fine, but it is the employer's responsibility. When it comes to travel, the Green Book does suggest a hepatitis B immunization for areas where they have a high or intermediate endemicity. The Department of Health recommends immunization, but it doesn't actually recommend that immunization is done on the NHS. We know that under the terms of service of the GPs, we are not allowed to charge patients a fee for anything we actually do. But of course, there are exceptions where the GP may, and the key word here is may accept a fee, charge and accept a fee from a patient who requests an immunization for which the PCT does not pay, that is to say, has not been put in the global sum in the additional services for us, and the patient requests that immunization because they are traveling. Then that can be private entirely, in which case the GP must purchase the vaccine privately, and then they can charge the patient for administration as well as the cost of the vaccine. But the regulations actually say that the GP may not charge. If, for example, I have got a very good reason why this patient traveling abroad should be immunized against hepatitis B before they go, I may not charge the patient and use an NHS vaccine.